Well, howdy there, Internet people, it's Belle again. So today, we're going to talk about the GOP plan to cut Medicaid, the ACA, and more. We've talked repeatedly about how the GOP can't get the cuts they promise their voters in the way they promise their voters. The cuts just don't exist in the discretionary budget, and that the only way to get them is through going after mandatory spending programs, like healthcare and food assistance programs. Mandatory spending programs are generally seen as programs that Americans consider out of bounds. What is being described as a menu of options has now come out. It's important to know that these aren't set in stone yet. It lists as options what it calls savings from the following programs: Medicare, $479 billion. Medicaid, $2.3 trillion. The Affordable Care Act, $151 billion. SNAP, TANF, and like programs for helping those most in need, $347 billion. These savings are spread out over 10 years. According to reporting, the Republican Party has been looking at these programs for months. So, during the election. You know, when many of them were promising they wouldn't. Those familiar with how Medicaid works and who uses it are probably scratching their heads right now. In a whole lot of red states, those getting coverage through Medicaid or the Children's Health Insurance Program amounts to more than 25%. If you live in West Virginia, Kentucky, Arkansas, or Louisiana, you might want to really pay attention. Mississippi, Oklahoma, and Ohio need to pay attention too. Enrollment is more than 20% there. There are blue states who widely use the program as well, but their reps are against the savings. SNAP is the same way. In 2022, Louisiana, Alabama, Mississippi, North Carolina, Oklahoma, and New Mexico led the nation in percent of people using it. These states in particular will be hit hardest. Here are some of the methods Republicans are looking at to create these savings. Adding work requirements, which, as usual, will end up simply creating more government bureaucracy. The red tape will make less people enroll. Another way of doing this is requiring yearly re-enrollment. Just add paperwork and hope the red tape allows them the ability to deny coverage. Reducing ACA Medicaid funding by reducing how much the government is willing to pay for those who make less than $21,000 per year. Because, obviously, those making less than $2,000 per month can just figure it out. Cut the base rate for Medicaid funding. The federal government matches a percentage of funding for Medicaid. The base rate is currently 50%. They may seek to reduce that to 40%, leaving states on the hook to make up the remainder or cut services. Shifting to block grants for Medicaid. This has been a Republican dream for years. In short, this switches federal funding for Medicaid to block grants instead of matching a percentage the state spends. It basically hands the state the responsibility to deal with how to implement the cuts. It seems very likely that at least some of this is getting through. It's going to be those who need help the most that get to reach the find out portion first. It's worth noting that even if they were to get all of this, it would still only be about $570 billion per year. If they're serious about that $1 trillion per year number, military benefits and serious Medicare cuts are next. Anyway, it's just a thought. Y'all have a good day.